Hi everybody, it's Dr. Ying Qi with OC Hand Surgery from beautiful Orange County, California. The treatments of carpal tunnel includes non-surgical treatments versus surgical treatments. In patients who has very mild symptoms or very early signs of carpal tunnel, usually you don't need surgery. The non-surgical treatment includes wrist brace. Again, as I said before, a lot of times when we're sleeping, naturally our wrist is bent like this. So that position actually puts the nerve on a stretch. Therefore, when we're sleeping and we fit you with a brace, your wrist is straight, and that's the perfect position to keep the nerve under minimal compression. If later on patients still have a little more symptoms, even with brace, then we'll try a low-dose cortisone injection. As you recall, the carpal tunnel is a nerve compression which causes a lot of inflammation because there's not enough room in that tunnel. When we put a low-dose cortisone injection in this area, usually the injection right here by the wrist area, that will decrease the nerve inflammation, and that can take a lot of the symptoms away. The recovery after carpal tunnel surgery is actually pretty quick, not very extensive. After the surgery, you'll be in a splint, which is a supportive wrap around your wrist and hand. All your fingers are free, so you actually can do stuff. You can be on your phone, you can be on your computer. And the incision is only about 1 inch long. It takes about 2 weeks for the incision to heal, or for the cut to heal. Therefore, for the first 2 weeks, you want to keep the cut clean, keep it dry, and elevate as much as possible. After 2 weeks, you come back to the office, and then the sutures or the stitches will be removed. Then you can pretty much go back to 80% of the normal activities. Because after surgery we do want everything to come back and heal nicely, we recommend for the first 4 to 6 weeks after surgery, you just basically take it easy. No heavy lifting. Also, some patients will require a few sessions of therapy. That's really to help patients to speed up their recovery. If the carpal tunnel is left untreated, there's actually consequences. The nerve compression is usually reversible once we took care of the problem. So majority of the case, if you have mild carpal tunnel and we did carpal tunnel surgery, usually your nerve will bounce back to normal and recover almost immediately. However, in cases where a patient has long-standing carpal tunnel syndrome, years, 5 years, 10 plus years, sometimes the nerve can sustain permanent nerve damage. In that case, the recovery after carpal tunnel becomes unpredictable. Sometimes they come back to normal in other situations with a less severe carpal tunnel syndrome. However, sometimes when patients have really severe long-standing carpal tunnel syndrome, even after we do the surgery, the recovery is either unpredictable or incomplete. Therefore, if you're diagnosed with carpal tunnel syndrome, I do recommend you to have the carpal tunnel surgery procedure done as soon as possible to prevent any risk of irreversible nerve damage. I hope you enjoyed the 2-part series on carpal tunnel syndrome. Looking forward to seeing you on the next episode of In Good Hands with Dr. Qi. Remember to subscribe to our YouTube channel, follow us on social media, and visit us at ochandsurgery.com. See ya!